In medicine, breakthroughs are made every day, but it is in the field of women's reproductive health that researchers have made astounding strides. Today's surgeons offer advanced treatments for women who are diagnosed with conditions like uterine cancer or other debilitating disorders of the reproductive system. Jean Woodman is one of them.
The condition I had was called hypermenorrhea, and it caused excessive bleeding to the point where I could not leave the house. I just could not go food shopping, I couldn't go to the mall, I couldn't go anywhere without having a lot of distress.
In the recent past, hysterectomy was considered a major medical procedure, but today robotic-assisted surgery allows surgeons to perform hysterectomies with just a few minor incisions, drastically reducing discomfort and recovery time.
The Da Vinci surgical system largely consists of two major components, one of which is the robot itself, which has 4 arms and stands adjacent to the patient. The other is the control console that is actually operated upon by the surgeon. And within that console, every movement of the physician is mimicked by the robot itself, so that one can make a very tiny motion in the console, and that is responded to by a similar motion within the abdominal cavity of the patient. Because one has 5 very small incisions rather than the typical 8 to 10 inch abdominal incision with conventional open surgery, patients have minimal postoperative pain and can leave the hospital within 24 hours and are back to relatively normal activity in as short as 2 to 3 weeks.
When Jean learned about the reduced invasiveness and recovery time associated with her robotic surgery, she felt a wave of relief.
I just could not wrap my head around the whole idea of a robot working on my body, but he showed me a short clip on the computer and it was just amazing to me that this could all happen and have no risk of infection and a little bit of bleeding, and I just said, let's do it. Today I feel great. I've come a long way and I feel wonderful. My life has changed for such the positive, and I do everything I wanted to do and everything I missed out on, and everything's great.
Reproductive health is an issue for every woman. Never before have there been so many minimally invasive solutions for the health concerns countless women will face.
My advice to patients who are considering some sort of solution to their medical problems is to really consider the possibility of minimally invasive surgery. It's not like the old surgery of our parents where there was an 8 to 10 inch incision. Now there can be a very rapid recovery with minimal surgery, and patients can get back to their original responsibilities.
Winchester Hospital is on the cutting edge of women's reproductive health. Located in Winchester, Massachusetts, Winchester Hospital delivers the same state-of-the-art technology as many Boston hospitals, but in a convenient community setting.
The mission of Winchester Hospital is to care, to heal, and to excel. The care part of that has 2 different components. One is the more obvious. It's to take good care, medically speaking, of patients who come to us at their most vulnerable time when they need medical care. But we try always to go well beyond that and to treat them as human beings with dignity. To heal addresses the dimension of trying to help a patient achieve their maximum level of wellness at whatever stage of life they might be. And to excel is part of our aspiration always to do the best we can at the first 2 parts of our mission statement.
Winchester Hospital was one of the first community hospitals in New England to offer robot-assisted surgery with the revolutionary Da Vinci surgical system. This technology allows surgeons to perform many procedures, including hysterectomy, with unmatched precision and control. Patients benefit from fewer complications, including less pain, blood loss, scarring, and a shorter hospital stay.
The procedures that can be performed with the Da Vinci system in gynecology are those involved in both benign gynecologic disease and gynecologic cancer. So it involves hysterectomy, removal of tubes and ovaries, and for cancers, radical hysterectomy, potentially removal of lymph nodes in the pelvis and mid-abdomen. Basically, we can perform an operation for cancer as long as it involves the lower 2/3 of the abdomen with the robot. As a surgeon, I find it extraordinarily important to me to have the best possible technology to get the best outcome for my patients, to give them the best possible opportunity to have successful cancer surgery, to have an uneventful recovery, and to do well in the long term. That means not only the best technology, but also the best staff, both in the surgical suite as a wonderful surgical team, and afterwards on the inpatient floor to speed the recovery of our patients and give them the best possible result.
Winchester Hospital's commitment to technology is born out of the fact that we see the commitment as consistent with our mission, which is to care, to heal, and to excel. The commitment to technology is not for the sake of technology by itself, but to provide the best tools and resources to the excellent clinicians that we have here. People taking care of people, using technology as a tool to achieve the best of health.
A combination of state-of-the-art technology and compassionate care is what draws patients to Winchester Hospital.
I had the surgery about 3 months ago, and it's been great. I'm back to work about 25 hours a week. I'm doing well. I would recommend Winchester Hospital because I felt like a person there. The care I got there was incredible. I hadn't been in a hospital in a lot of years because I'm petrified of them. So it was wonderful to feel like, I felt like I was home almost. The nurses were caring, the doctors were caring, Dr. Fuller was wonderful. It was a great experience if you have to go through surgery.
Winchester Hospital has been fantastic for me through the years, but they were just great. My recovery was great. I was in and out, and they really took care of me.
For women, obstetrics and gynecology is a critical component of their health care. Winchester Hospital delivers the cutting-edge treatments that help women get back to their families and return to normal life as quickly as possible. For more information, visit winchesterhospital.org.